So welcome you all to the journey of female sexual health. This is me, Dr. Sunita Patel, and I'll try to give you my level best into this session again. We all know that when we talk about the female sexual functioning, the first and foremost organ which plays the crucial role is the brain actually. So we know that primary sexual organ is clitoris, and there are secondary sexual organs are also there, like vulva is there, vagina is there, mons pubis is there. They all are secondary sexual organ, but primary is brain. What our female is experienced in her life, what is her learning process, what kind of attitude she has gone through in her life about like from the sexual partner, and what is the effect of hormones in her life, that all plays an important role. And depending upon that, there are 2 to 3 hormones which is very, very important to come secret from the brain. So we need that particular initiation of the hormones from the brain, and these hormones are going to turn the brain in and like on and off. So very, very important hormone which we all need as a woman and as a man also, people need it. The very important hormone is oxytocin. There is one fact about oxytocin is that every female, whenever we are into love with some person, and when the love starts, oxytocin release starts from the brain. When we love from the depth of our heart, and our brain is also accepting the person, oxytocin release comes into the picture, and then sexual hormones comes. So the first hormone which kind of somewhere control us is oxytocin. If our behavior actually, if oxytocin is not there, it means the love is not there, that the sexual hormones might be, they will not come into the second stage. So very, very important hormone is oxytocin. If I'll give you another fact about male, whenever male is having sex or sexual activities, their first hormones are the sexual hormones, testosterone. That is the first hormone which comes into the picture. And throughout their sexual activity, the level of the testosterone and sexual hormones will be there in a male body. So the secretion will be high. But oxytocin release is there or not, that depending upon the person loves the man loves the women or not. If the man is having a sex with a girl whom he's not in love with, oxytocin release doesn't come into picture in their life, in their sexual, that particular stage. So oxytocin release only comes when the man is in love with some women. And if he's just having a sex with a girl and a woman, and he didn't fall in love with the particular women, at that time, this is not going to come. Oxytocin will not come into picture. Okay. He can finish the sexual act without oxytocin, with only that sexual hormone. But when we are talking about a female, when female is entering in a sexual act, so oxytocin hormone is the main important hormone, which is gonna give the command to the body, how the body has to react. Okay, so oxytocin is very important for female, and that is not that much important for male. Okay, so this is an important fact. So once the oxytocin, we all know that oxytocin is a love hormone. It's like a cuddling hormone. It will, like, whenever that love and cuddle, that kind of feeling only comes when the female brain is storing the good experience about the particular moment and the particular person. So after release of the oxytocin from the brain, then the other hormones release is going to come. Other hormones are like nitrous oxides releases there. Oxytocin is going to increase the nitrous oxide release also, and other sexual hormones, estrogen level and testosterone level, they all will come into the picture. Androgen level, they are going to come, and estrogen, testosterone, androgen, they are going to act on the primary and secondary sexual organs like clitoris, vagina, nipples, breast, labia majora, minora. They are going to increase the desire to have sex. So that this is also very, very important, that hormones are important. Depending upon different stage of our life, hormones are gonna play a different role. That's why female sexual behavior, depending upon what stage of life she is into. So we can understand puberty time period. So every female goes through these different cycles in our life. Once we are going through this puberty time period where our body is showing us changes, new organs are there, breast development is there, vulva is developing, clitoris is developing, uterus is developing, which ovaries are developing, complete internal reproductive system, external reproductive system, internal sexual organ, secondary sexual organ, primary sexual organs, they all are developing. This development, inside development, is going to give us the change into the pelvic region, because organs are placed in around the pelvic region. So the pelvic bone is going to go for widening at that particular time period, and this widening of the pelvic bone is going to give some shape to the body around the lower side, around the pelvic side. Same way, we have a breast, and breast is present around the thoracic level, and the breast development is going to happen. So the breast increase into the volume of the breast is going to give you the shape around the thoracic region. So the thoracic cage as well as the pelvic cage, they both are going to expand. They're going to show you some kind of more volume and more widening. So this is going to give a different shape to the female. Another thing, fat level is very, very important. Fat is also going to come, and this different, more like kind of fat consumption around the hips, around the thighs. They are going to give a different shape to the female, and female is going to acquire this kind of new changes, new body. And when she look into the mirror that these new organs are there, there will be always an urge to touch those particular specific organs. This is very, very important that we all should understand what happens during the puberty and how the hormones create the changes. So now whenever something new is there, we really want to explore the new things. So now what is new into the puberty time period? New body is there, new organs are there. So the female wants, this is a time of experimentation for the girl, that she might want to see herself again and again. She might want to touch herself around those particular sites, she want to explore those areas, and that what type of sensation she's having into those different areas. So puberty is a high time in our life, in a girl's life, when adolescent time, I'm talking about, not the puberty specifically, adolescent time, late puberty, when the organs are developed. So this is a time when the sexual hormone release is there, because sexual organs are there. Okay, they are there in the body. So the organs has to be functional. So body is going to secrete some kind of hormones, release of the hormones. So during the time of puberty, there is always a rise in the, not a rise, suddenly the arise, actually they are coming into the picture. So this is the body is welcoming new hormones. So when the new hormones will be there, new response will be there also. And because of this sexual hormones rise, there will be always increase into the desire of self-touch of the organs, sexual organs. And this is a time period when the sexual desire is somewhere coming in a female life, first time. And depending upon she likes that touch or she don't like that touch, and that is gonna give her the next boost in her life about this particular one experience. This puberty time period is again a time when she is looking the other people body also, other girl, how the girl is looking, how their boys are looking. So they are gonna attract towards the different body, different person, and this is a time of attraction, and this attraction means they might start having this kind of sexual touch or this kind of experimentation with the body. So puberty is a high time. In a puberty and adolescent time period is a very, very fragile time also, because it is very new for them, and but they want to experience those new feelings, those new things. So, and they will experiment with the touch. So always the sexual behavior comes, and sexual behavior might risen up as well during puberty time. So because hormones are there. Another time in our life. So during this puberty time and adolescence time period, like between 14 to 18 and 20. So this is a time period when the desire will be always high to touch the organs or to have the sex or to explore the other person. So this is the high time for the sexual behavior between 14 to 20. After that, there is another time in our life when we start loving some other person. We start falling with someone, and we are like, might be that we are getting engaged with someone. We are into the time when we want to marry with someone. So this is the time when the body really into the phase of, body is also already there into the phase of reproduction. Body really want to reproduce, but specifically here, the target of a female is getting uh, sexually intimate with some person, because because society is also telling her like, okay, we can she can get married. This is the right time. So after 18 to this above 18, that during these reproductive time periods, there's always when she is into some kind of relationship, serious relationships, there will be always some high desire to have sex. So when we are starting the relationships with someone, okay, so high desire will be there when some new person is coming in our life. So during this reproductive time period, but this time when someone is entering, still there can be something which can hold us back. So I am falling in love with a person, but as per my society, my belief system, I can't have sex. And because having sex is not good before the marriage, so I might wait until the marriage, or I might have a fear that if I'll have sex, so if someone will find out about this, it can be a problem, or if I'll get pregnant, it can be a problem. So still the fear will be there, and this fear is the vasopressin. So she really want to go through, she really want to, the oxytocin release is high, but vasopressin release will also be there during this particular time period when we are starting our intimate relationship with someone. And that vasopressin can again give this oxytocin can give the desire, but this vasopressin can stop that. She might don't go for arousal state, and she might don't hit the orgasm also. So reproductive years are important years of our life, but into these years there can be the fear, or there can be the desire to have the sex, depending upon what is the priority for the female. Sometimes we don't want to have sex because female don't want to have sex because she don't want to get pregnant. Or sometimes like female wants, she's married, she's married, she's sexually active since 1 year, 2 year, 3 years, and now she wants to get pregnant, and she's doing everything her level best for the pregnancy, but she's not conceiving. So once she can't conceive because of some other pathology, whatever problem is going on in her life, she's not able to conceive, and she want to conceive, but then whenever it can also affect her sexual life. So next time, whenever she will go and she will intimate with the partner, the one thing will be in her brain always that I want to have sex because I want to get pregnant. So her goal will change. The intimacy and feeling will not be important for her. Oxytocin release is not important for her. For her, the sexual hormones release is not important for her. The importance is that she really wants to have ejaculation inside the body, and she want to get pregnant. So this kind of brain, what the brain is thinking, sometimes brain is having a fear, sometimes brain is having a desire, sometimes brain just want to have sex just to conceive something. So during reproductive time period, what your brain is feeling can always affect the female sexual behavior. So some females, they just want to involve into the activities just to conceive. So during this time period, lubrication, orgasm, or completing these stages is not important for the girl. What she's thinking actually, what the brain desire is, that is more important than what the body desire is for those particular time period. So that can also be a case. During so every time, every stage of life, our sexual behavior will be different. So if a female is pregnant, for example, I am pregnant, you are pregnant, so during the pregnancy, the brain and body first goal will be just continuing with the baby growth. We don't want to do anything which can harm my baby. So my body's ultimate goal, my ultimate goal is having a live birth and healthy birth. So I might don't want to go for sex, and that I will not even think about having a sex, because if I'll have sex, that something can happen with my baby, and so there will be fear again comes during this time period. So this kind of fear can always affect your sexual behavior, sexual functioning, the level 5 level. They might don't come. The desire can go down, okay, because pregnancy will give you a fear, and the fear will be there. The desire, it is going to affect the desire. So during the pregnancy, desire dysfunction can we can see in a pregnant women's, like they don't have a desire to have sex, and if they are having a desire, they might don't want to go for arousal also. Desire itself is going to affect pregnancy, is going to affect that, and that is because of the fearful situations. Arousal or achieving orgasm, perineal trauma, pain. Yeah, another thing is I'm talking about during this postpartum time period. As soon as the female is gonna deliver the baby after the labor, and the baby's outside, so we don't know what happened with the perineum. We don't know how the baby came out into the world. And as soon as the baby childbirth is there, lactation is the main priority of the body. Body wants to do everything for secretion of the milk, because body know that baby require milk. So at that time also, desire dysfunctions will come. The female will not have desire to have sex, because sex is not her like kind of aim and goal at that time. At that time, her goal and the body need is lactation. So that's how the prolactin will be more high, more active and more dominant, and the sexual hormones will subside, and they are not that much focused for the this postpartum mother. She's mother now, okay? So as soon as the baby is inside the womb, she will become a mother, and when she's a mother, other things will come into the picture. So that is gonna affect that drastically their desire. So as a mother, our desire to have sex is always low. So we don't want to go into that during pregnancy also, and even postpartum hormones can also affect our drastic change into the desire. So desire dysfunction can come into the pregnancy and postpartum time period. Arousal or if the desire is not there, so we can understand the arousal will be also not there, then the orgasm will be not also there. So it's going to disturb our things, our whole stages. So female can, we can see that she has a sexual dysfunctions going on, but that sexual dysfunction is a episodic sexual dysfunction. So this is not a permanent thing which happen in a female body like menopause. So during menopause, after the menopause level, hormones will go out. Some hormones level will be very, very low. And that is a kind of permanent effect which is going to happen in a body. But the pregnancy is an episode till that whenever she will get pregnant, 1 time, 2 time, 3rd time in her life, that is the only phase the desire will be down. And whenever she's a postpartum mother, immediate newly mother, so at that time when she's lactating, she's feeding the baby, till the time the baby is close to the breast, so her focus will be the baby, not the husband. And another thing is, we don't know that what happened after that after this delivery. We know that she's lactating, and lactation is going to affect the desire. Another thing which can affect the female having the sex, like she's gonna like the sex, or she's not gonna like the sex. That can also affect what type of body is left after having the baby. Sometimes baby comes out through these vaginal deliveries, and we have a perineal tear, episiotomies. So this episiotomy, perineal tear, they might leave some kind of scarring, some kind of tightness, tight tissues, some kind of adhesions around the perineal body. If there are some tightness around those openings of the vagina, around the opening of the vagina, so if the female she might have a desire to have sex, and whenever she'll go for sex, and the 3rd stage will come, the penetration, So this scar might create tension, and they might create a difficulty in penetration because of this shortening, by creating this kind of shortening of the skin around this area. The vaginal tissues will get tight because of this, they will get scarred, and because of this adhesion formation between the skin tissues and this underneath muscles, small muscles like bulbocavernosus and this kind of superficial transverse perineum and the pelvic floor muscles, they all get torn, and they develop some kind of stitch. After the stitches, they develop some kind of scars, which might be present only, might be superficial or deep also. Deep scars also can be there. So these kind of things can create a tightness into the tissue around the vagina. And through the vagina, whenever the female will go for penetration, she might feel some kind of tightness, or she might even she might not be able to penetrate inside the vagina also. So these kind of situation can give the female vaginismus effect. We call it as a secondary vaginismus. It's not a primary vaginismus, because there are two types of vaginismus, like pelvic muscles are spasmodic and tight, and female cannot penetrate. So one can be like she never penetrated in her life, but she was penetrating before the having a baby, but after having the childbirth, because of these tight structures, she's not able to penetrate. So that's the secondary vaginismus she might develop after having a baby, and that can cause pain, cruciate pain, and if the penetration will not come, will not happen, so that it is going to affect her orgasm. So this female can have an orgasmic dysfunction. Okay, orgasm will not come into picture. So no penetration and no orgasm inside the vagina. So then but these females were not aware about the external stimulation, because clitoris is one thing which is not explored by many of the women. Only some women are aware about this particular fact, that we can have orgasm only by this external stimulation also. Their mind is thinking that vaginal stimulation is important, and vaginal penetration is important to have this orgasmic effect. And even the partners are not aware about this fact, and partners main target is just to go inside the vagina after having the like during the sexual activities, and because penis get good grabbing inside the vagina, and that is only how the male will feel the orgasm. So this can affect a female as well as the male orgasm, that how much relaxed the structures are after the postpartum stage. The perineal trauma, how it is affecting. Okay. Another thing which can affect a female in postpartum phase is a change in her body image. So what happened actually is drastic change in her mind. Whenever she look her body into the mirror, she might think that, oh, like I put a lot of weight, I put a lot of weight, weight gain is there, and my body is not like that, like before anymore. And when she look at her husband, so husband body has not gone through any change, any different, there's no difference in his body, but there's a drastic change in my body. So this kind of things can always affect her mind, that how positive and negative attitude she's having about her own body, and that can always affect her desire to have sex. She might start having this kind of feeling in her brain that my husband might be not liking my body, he will go away from me. So there might be a lot of thought can suddenly come in her mind about the body image. So that also affect the female's sexual behavior. If I'm not feeling good, I will not be confident. If I'll not be confident, I'm I will not be confident about my body and my relationships also. So that is going to affect the desire to have sex. Okay, I might feel that, oh, I'm not the same anymore, and this kind of guilt, and not the guilt only, it's like this kind of comparison between two bodies can always affect the relation, this kind of activities, function behavior. Another thing is low self-esteem. Yes, low self-esteem and too much of weight gain, everything is can affect the female the perspective of looking, of seeing some things. So pregnancy and postpartum can always create some different type of different type of thoughts in the brain. And if the brain can switch off the can switch off the can off the switch. Okay, so it's not ready to have sex because that can give the desired dysfunction to the female. Another stage in our life can come perimenopausal period, like when we are into the relationships, in the same relationship since many years. It's been like we got married and then we planned a baby, and there's one pregnancy, second pregnancy, third pregnancy, and after that the baby is 8 years old and 6 years old and 3 years old. So that particular in time, lot of responsibility will come into the picture. So I am not the single person and who can spend a time with my husband. So it's like we are now 5 people, we are 4 people in a family. We are not only 2 people, we are 3 people in a family. So this extra responsibility are there. So his focus is there to take care of the family. My focus is also there to take care of the family. So that particular responsibility can also create change in our life, lot of change in our life. How, what is more like important for us, having a sex or having take care of the baby, or the responsibilities, take care of the responsibilities which we have. We have a responsibility of our house, we have a responsibility of our baby, we have a responsibility of our family. Many things comes into the picture, and they can always make a person get this kind of over responsibilities, can get a person tired. So she don't have time to think about those kind of activities or sexual activities because of this over responsibilities. And that can give sometimes a lot of different moods also. Some females might go for depression, that I don't have time for myself, and she might stuck between the home, kids, and the office work is also there. So the job, everything. So that can also create a lot of problems, intimate problems. So she don't spend time with the husband. They don't have enough time to spend with each other. And the end of the day, they are tired and they'll just go for sleep. So that can always affect the relationships, and that can always affect their sexual response. Not only the responsibility, when we are spending a time with the same person, like it's like 10 years, 20, 12 years, 15 years, we get to know some other side of the person. It is not only the love which we can see. We both are sharing the responsibility, and how much responsibility who is sharing, and whenever we are sharing the responsibility, how we are treating each other actually. So the responsibilities are there, good and bad times are there in a life. So if during this particular time, how good is the chemistry between both of them, or they ended up into the fight and they failed to respond to each other at the end of the day. That is gonna also give some kind of experience every day to the female and to the male also. So we are talking about the female. So this kind of experience that we don't have a chemistry, we are always having this kind of fights going on. So that is gonna again diminish the desire to have sex with this person. Okay, I'm not saying the desire to have sex, desire to have sex with this particular one person. That can always affect. And that can sometimes in our life, there might be during this time, some phase of our life, that when the hormones are not balanced, our periods are not normal. So when the periods are not normal, we don't know which hormone is high, which hormone is down. And the hormonal fluctuation can always be the reason of causing some kind of dryness, lubrication inside down around our perineal body. So I have a desire to have sex. I wanna, my body is also getting aroused. I want to have sex, but as soon as during the arousal stage, I feel dryness inside around the vagina. So there's no lubrication. The less lubrication can be there because of the hormones, estrogen level effect, testosterone level effect, or the structure itself is atrophied. The skin is not healthy. The blood capillaries are not functional completely. Some capillaries are they create some kind of blocks down there. Okay, so they are not completely functional. We don't take care of our body, so that all can be the reason of creating the lot of issues in or some health conditions, we might during this time period when we are around 40, 45, it's not only that there might be some other problems start coming, health issues start coming up in our life, and because of those health issues we might be taking some kind of medication, and those medication can have a side effect onto the estrogen or onto the sexual hormones. They might create they can diminish the estrogen level, and they might create that can be the source of vaginal dryness. So if I really want to have sex, but my vagina is always dry, and if I'll have sex with a dry vagina, so that is going to give me some kind of laceration around the vaginal skin. So I pain during the sexual activities. So the dryness it can be also cause, which can stop a female to get penetration, to get intimate. We call it again as a lubrication issues, which are coming. So whenever lubrication issues are there, so lubrication issues can come because of two things. One is the psychologically. When I'm psychologically not ready to have sex, my brain will not secrete oxytocin, and when oxytocin will not come, the arousal will not come, body will not go in an arousal stage, and then if the other person will have sex with me forcefully, so sometimes we are not liking our partners, and we have to have sex just because he wants to have sex. So, or might be he want to have sex forcefully with you as a partner. So, but we don't want to have sex. So at that time, our vagina will not be aroused. Our this downward structures will not get aroused. So the vaginal area will be dry, penile area will be dry. And having sex with this kind of vagina will be very, very painful for us. It might give some kind of laceration, some kind of bleeding. It can show some kind of bleeding and difficulty and those kind of behavior, those kind of issues. And that will ended up into that wrong experience of having sex. So we might don't like this kind of sex anymore, and we will stop sleeping with the person. We might start avoiding the person, and that can also come into the picture. So how you're psychologically you are involved with the person who are having a sex. So when we are spending some time with the same person, there might be psychologically there's a differentiation, different aspect actually we develop, and different kind of thought process. So his thinking is different, my thinking is different. So that can always affect the relationships, and if the relationships are not good, our body will not have even desire, and body will not get into the arousal stage. It can show dryness, and dryness will give pain, and that is not a good experience again for the female. So this female will not go for sex. The sexual response will be down. Yeah, all these things can affect. And if she hit menopause already, so we understood that after menopause, there's no egg left. If there's no egg left, there will be no ovulation. So estrogen, progesterone, testosterone effect can be always, the effect will be always down. So no longer fertile. Female might start thinking that my period stopped and now I'm getting old. So this kind of things can store in her brain, and this kind of thinking can affect her that I'm not longer fertile. It can affect her mind. And same way, some other general health declining, the other health conditions can also affect her body. And this kind of effect of medication onto the hormones, hormonal level can even create more reason to develop the sexual dysfunctions. Another thing is emotional, physical changes in the partner relationships, in the partner or into the relationships. How emotionally we are still connected with our partner at the age after the postmenopausal time or during this, any time in our life. How emotionally we are connected. So it's like directly oxytocin. If we are not emotionally connected, oxytocin will not come. You might have seen that whenever in our life we are starting the new relationship means new intimate relationship. So if I am if you are in a love with a person, and then suddenly because of some things we might get divorced, and we moved, not divorce only, we just moved out from this relationship. So whenever new person will come, the desire to explore other person's body will be always high. So it doesn't matter how old we are, whenever we are falling into the love, oxytocin will come, and oxytocin will affect the body to release the hormones. So if a female age is 70 years and she's falling in the love at the age of 70, so the oxytocin release can create a fact into the body and can create a desire to have sex, and desire to even the body can go for arousal stage because of the oxytocin hormone. Okay, so arousal, and if the body can even respond. If like my body, for example, I'm 70 years old, and during this particular time period, it might be the estrogen level is down, but if the desire is there to have sex, person will try to search for some lubricants. They might apply some lubricant and want to experience that other person's body. So it doesn't matter what is the age of the female. If the brain wants to explore the sex, the body will always react. So our cycle starts with the brain and ends with the brain. So what brain wants to explore? I have a desire. So brain is telling you, and at the end of the orgasm, brain is relaxed. Brain like this experience. So everything starts with the brain, and everything finished on the brain, how your brain is feeling. Okay. Still, this kind of some phases of our life can always show different behavior, different pattern, different hormones, and they can always affect us. Whenever we are into situation where we are too much depressed, when there's too much of fatigue going on, so our sexual response will be always low, because body is not feeling good, brain is not feeling good. So whenever we are not feeling good, body will not go for desire and arousal phase. There are other, it's just one image which I got from the Google actually, causes of low sexual drive in women. Some females, they have low sexual drive. It doesn't matter which phase of their life they are, during reproductive time, during this 20 to 30, 30 to 40, 40 to 50, or whatever age. So some things are kind of, some factors can always affect. Whenever we are tired, throughout the day, when we are tired, what body wants to do? Body wants to sleep. So sleep is the main priority instead of having a sex. So when we are tired, so that can affect a female. So this is just an episode that I'm tired today. You are tired today. Okay, so that's episodic. The pregnancy, when she's pregnant, it can affect her a female sexual desire and arousal stage. And orgasm, I don't go for this kind of, orgasm and everything. When she's lactating, breastfeeding, because during this time, estrogen and testosterone level is always down because prolactin level is high. When the female, the self esteem is down, we're not thinking good about our body, and we start comparing ourselves with other person. Everyone is special. Actually, we are special. It doesn't matter how you look. What matters is how happy you are. So, but some females, this poor body image can always affect them. They might keep comparing themselves even with the other people, with this kind of porn movies that, the beautiful figure. We should not think about that. Actually, everyone has a different things in their life, but still they are comparing, and that comparison, this kind of it can give low self-esteem to them, and they might don't go for sexual activities. Relationships issues. Yes, if the relationship issue, the experience is not good, so the person might don't go for sex, and this is not, that desire will not be there. After menopause, hormonal level can be down, anxiety and depressions, because at that time oxytocin level will be down, low self-esteem, stress, sexual problems. Sexual problems means when we have female is having lubrication issues going on. So there's not enough lubrication. Might be she's not able to penetrate inside the vagina because of the vaginismus. Might be she has some other health condition going on in her this reproductive health, and around the uterus, around this pelvic organ, some pathology is going on, and because that pathology, she might have inflammation, and that can give her pain during having sex. So the desire is there. The arousal body is also going for arousal stage, but the penetration is giving her pain, and she might don't hit orgasm. Sometimes our nerves which supply around this region, like pudendal nerve, so the female might go for pudendal neuralgia. The nerve is entrapped somewhere, and if the nerve is entrapped, that will always give the stabbing pain around the vulval region. So she might don't touch her. She's not able to touch her vulva. Vulvodynia can be also there. Vestibulitis can be also there. Some inflammations or some infections which is going on around the urethra and around the vagina, they always affect a female. Some sexual problems, and like not a sexual problem, these kind of problems can affect the sexual health issues. And it can be the other person, the partnership, the partner's issues. If our partner is having erectile dysfunctions or premature ejaculations, or they are not able to sustain the erections, or the relationships are not good, the chemistry is not there, mindset is not there, they can always affect the female sex. Or the history of physical or sexual abuse. If a female has gone through a bad experience in the life, that kind of the flashes will always keep coming in her brain whenever she think about having a sex. So might be it will diminish her desire to have sex. She might start thinking that all the men are same, and she might don't go for it. And she's kind of avoids herself and from the sexual act. No, I don't want to have sex in my life because I don't want to intimate in my life. I don't want male in my life. She might start thinking this. Everything, these things we are talking about as the aspect of the vaginal sex actually. So I feel that all this kind of whatever I have told you so far is reasonable till the time we are talking about the vaginal sex. But the clitoris is outside. The glands of the clitoris is outside. The female, male, the world, we are not aware about this fact that external stimulation doesn't require, this stimulation to the sexual organ doesn't require the vaginal penetration. Okay, so pregnancy, breastfeeding, and those kind of things, estrogen level, low estrogen level, these kind of things, not always a fact actually. It is what is important. The female should be knowing, the fact that clitoris is outside, and she can always do the monosexual activities. So we don't require other person sometimes. So sexual activity can be done solo and externally. There are, as a whole, I try to divide what can affect a female sexual dysfunction. What is the factor which is affecting a female sexual dysfunctions? I try to divide that into 4 different types. So one is organic, psychological, relationships issues, or socio-cultural. Why female don't have a desire to have sex, or the arousal dysfunctions. So there are altogether how many types of dysfunctions? Let me show you first. These are the types of dysfunction. So as per that, yesterday itself we talk about it, that there are altogether 4 types of dysfunction. Sexual desire dysfunction. There is she don't have a desire to have sex. Arousal dysfunction. Body has a desire, but body is not going for arousal. Hormones are responsible for this. And different stages of life. Women is pregnant, she's lactating, she's menopausal. All these are the stages where it can give us around hormonal disturbance. Orgasm related disorder. We might be into the sexual intimacy, penetration is going on, but my vagina is very lax, my pelvic floor muscles are very weak, there is no grabbing effect, so the vagina tone is not there, pelvic floor muscle tone is not there, and they fail to bring the this sexual organ, the penis, towards the clitoris. So grabbing is not there. If the grabbing will not be there, the proprioception will not be there. Brain will not get the sensation. If the brain will not get sensation, orgasmic reflex will not come, and female might not hit orgasm. Normally, 70% of female who are into the sexual activity, they don't know what is orgasm is actually. They only have sex just for the sake of the partner. They don't enjoy sex. Only 20 to 30% of female, they enjoy sexual activities. And the fact is only 18% of females, they hit orgasm with the vaginal penetration. And we understand those 18% of female who can hit orgasm is because they have a good tone into the vagina and they have a good strength into the pelvic floor muscles, and the reflexes are also strong, and they are giving them the good kind of grabbing and bringing the penis towards the clitoris, and the clitoris will get stimulated from the vaginal anterior wall. So that's how 18% of females, they are getting orgasm through the vagina. Other 70, how much? 82% female. 82% is a huge number actually. They don't get orgasm, okay, during this vaginal penetration. And why they fail to hit orgasm? Because, and they are mostly mothers actually, after having a baby. After having a baby, vaginal tone is down. Vaginal like rug is flattened. Vagina is not toned and strong like before. Tissues are kind of flat, kind of weak tissues. And even the pelvic floor is also very, very weak after giving the birth to the baby. 80% of pelvic floor muscles are going for the separation. So they get separated and they develop a lot of weakness during pregnancy, and after having this even after having this into the postnatal time period, whenever that healing is going on. Healing means only they heal, they don't get strengthened again, because pelvic floor is a skeletal muscle. Once something happened with the muscles need rehabilitation. But pelvic floor muscle rehabilitation in postnatal time period, I don't know how many of you are mother and how many of you got pelvic floor rehab in your postnatal time period. So none of us, we got pelvic floor rehabilitation or strengthen our pelvic floor muscles after having a baby. So this lack of the knowledge and lack of the practice, even the physiotherapists are the people who work with the muscles. But as a physiotherapist, we never been taught in our college, in our schools about the pelvic floor muscles. So we don't know how to strengthen the pelvic floor muscles and when to strengthen the pelvic floor and how important it is to strengthening the pelvic floor. After having every baby, every childbirth, it is compulsory the pelvic floor muscle strength should be given back to the female, because pelvic floor muscles weakness will be very high. 80% weakness will be there into the pelvic floor. Okay, so most of the female, they have a weak, loose pelvic floor muscles afterwards, and never get rehab, never get strengthening of the pelvic floor. So that is also, that can be that is also a very, very important factor why female, they are not liking the sex, and they don't feel the sex and arousal or the orgasm after having a baby, because of the vaginal laxity and because of the pelvic floor muscles weakness. These are the two factors. And so pelvic floor muscles are like a door. If the door cannot close and cannot grab, so the grabbing of the penis towards this anterior wall will be weak, and the grabbing towards the clitoris will be weak. And that's why, and they don't know that the clitoral stimulation can happen from outside. Outside stimulation can also be given by the partner. So partner is not aware about this fact. So most of the female, they don't experience orgasm in their life after having the baby. So orgasmic related disorders can be also there, and orgasmic related dysfunction can be because of female weak pelvic floor, vaginal laxity, or it can be because of other person, your partner behavior. If our partner is having erectile dysfunctions, so the erection is not there, so we are always thinking that vaginal sex, this is only the one important thing actually. So this erected, if the erection is not there, penis will not be able to go inside the vagina. If there's no penetration, so they might don't have sex, and they might if not hit orgasm. Orgasm can be felt. It should be felt actually, not a can. It should be felt externally also, because by stimulating the clitoral glands, which is present outside. But most of the partner couples, they are thinking that orgasm, this erectile dysfunctions can affect the female orgasm. No, it doesn't affect normally actually. It only affects the penetration, but not the orgasm. Okay, female can still have orgasm. Another is if the female is having a tight pelvic floor, there is some kind of tightness into the tissues, skin around the vaginal area, or some kind of problems going on around the vestibular area. They always can give pain during the intimate time period. So sexual pain disorders can also be there. So altogether, they are sexual pain disorder, hypoactive sexual desire disorder, HSDD, sexual arousal disorder, SAD, or orgasmic disorder, sexual orgasmic disorder, SOD. So there are 4 types of dysfunctions. I try to give this again. Hypoactive, females are not acting, decreased interest in sexual activity. It can be because of psychologically, because I don't like sex, experience was not good. It can be physically, something is going bad with my body, something is not good, I'm taking some medications. It can be medical issues, it can be emotional issues, it can be hormonal issues. I'm not interested to have sex. So these can be the issues. Whenever your female is telling you that she is not interested in having a sex, so it will be only these 5 issues. Okay, we have to know as a therapist. Sexual aversion issues. Some female, they just completely avoid the sexual activity in their life, and they'll think, no, I'm not going to have sex. It can be emotional sometimes when they lost their partner because of some reason, okay, or the partner cheat on them. So some kind of things when they think, no, like my partner is no more there, so I don't want to go for sex. So this is her belief system. Or it can be that she don't want to have sex completely because of the bad relationships, bad experience, lack of love, lack of understanding, cultural, or it can be, no, I don't want to have sex before marriage, cultural issue, religious issues. So it is again coming from the brain, coming from the mind. Third is a sexual arousal disorder. Female want to have sex, but their body is not able to go for arouse. So again, I told you looseness of the vagina, or tightness into the vagina, or dryness into the vagina. Vagina can't grab, vagina can't penetrate, or vagina has a lot of dryness issues. So inability to maintain vaginal lubrication until the sex act is completely I'm so sorry. So there can be any reasons for this. Fourth is again same, I explained to you, orgasmic disorder, lifelong and acquired. Lifelong means never experience orgasm. Some females, they don't know what is orgasm actually. And some females, they know that in past, they were feeling good during the sexual activity. So look, what we are talking about, vaginal penetration actually. So some females will think that, oh, I was feeling good inside the vagina before, but I'm not feeling good. I'm not feeling orgasm now because of the many issues which happens into the vagina. Or pain disorders. So we understood this. So again, you can take a screenshot. I tried to club everything into this slide. Psychological factor. What psychological factor can be there? Fear, mental inhibition, past psychological trauma, or problem with the partner. Organic problems. What organic problem actually? Gynecological problem or some systemic disease. What can affect a female sexual behavior? So please take a screenshot. Vulvitis, colpitis, atrophy, vaginal stenosis, endometriosis, intraabdominal adhesions, gynecological surgeries, radical surgeries, some malignant tumors, diabetes, stress-related exhaustion, depression, multiple sclerosis, some drugs like contraceptives, antidepressant, antihypertensive drugs, they all can have an adverse effect on female sexual behavior. And oophorectomy, radical hysterectomy, when they remove their uterus, when they remove their ovaries, when there's a pelvic radiotherapy is going on, chemotherapy is going on, vulvectomy is going on, they can always create some kind of issues into the pelvic region, the organs, skin, tissues, as well as the muscles and the hormones. Okay, so these are the factors which affect our female. These are the dysfunction, and these are the factors which affect our female. A physical factor can be there, hormones can be there, vaginal deliveries can affect, C-section can affect, aging process can affect, pelvic floor muscles. Too much of tightness into the pelvic floor will not let the area, we can't touch the area because muscles are spasmodic and they are giving us pain. Or if the muscles are very weak, so there's no grabbing, the less lack reflexes, and urinary, some other conditions like if urinary incontinence is going on, if a pelvic organ prolapse is going on, something is falling out from the vagina, that they all can affect a female. Hemorrhoids are there, piles is there, fissures are there, they can always affect a female. And the psychological issues like anxiety, religious issue, new mothers, depression, low self-esteem issue. We explained that. So these can be the life stages and some factors which affect a female sexual dysfunctions. I hope you are clear. Any question in your mind?
Yes, ma'am.
Okay, great.
Ma'am, please, how can we say about the hyperactive sex drive?
Sex drive. Yes,
Yeah.
some is